Assalamu alaikum and a very good morning to everyone. First, let me introduce myself. My name is Sarah Adilah binti Muhammad Subri from Universiti Teknologi Mara Pulau Pinang, alongside my partner Siti Natasha binti Shukri and Dr. Samsudin bin Wahab has written an article on leadership theories in COVID-19 outbreak management. Firstly, I would like to give you some background information about coronavirus disease or COVID-19. COVID-19 is caused by a newly discovered coronavirus, an infectious disease. Most people infected with COVID-19 will experience mild to moderate respiratory disease and will recover without special treatment being needed. Globally, there have been over 50 million confirmed cases of COVID-19, including 1.25 million deaths reported to World Health Organization or WHO. Older people are more likely to develop serious diseases, as are those with underlying medical conditions such as cardiovascular disease, diabetes, chronic respiratory disease, and cancer. The COVID-19 virus spreads primarily when an infected person coughs or sneezes through droplets of saliva or discharge from the nose. Hence, it is crucial that you also practice respiratory etiquette. According to Gopinath, the crisis has caused hundreds of thousands of fatalities, tested the limits of health systems, and has put the world in interment wherever the worldwide economy is experiencing the worst recession since the Great Depression. Next, do you know what is an outbreak? An outbreak is a time when something suddenly begins, especially a disease or something dangerous or unpleasant that normally occur in small communities that have the potential to trigger extremely high burdens due to overwhelming healthcare system. According to WHO, it can happen for several days or weeks or for several years. The pandemic has spread across a large region, such as multiple continents or worldwide, affecting substantial number of people. Basically, the aim of outbreak management is to protect public health by identifying the source and enforcing control measures to prevent further spread or recurrence of the infections. To ensure the importance of outbreak management, the recognition of a potential outbreak is indeed necessary. Subsequently, the sources of infection must be detected, even better, eradicated. The eradication of the pandemic is necessary to stop further spread and to avert recurrence. The prominent part of outbreak management is effective communication between the involved parties and to spread the lessons learned when the outbreak has resolved. According to previous research on leadership theories help in outbreak management to continue the sustainability of organizations and achieve the desired outcome. Early research on leadership psychology have pointed to the fact that leadership qualities are innate talents that people are born with. It wasn't until recently that systematic leadership theories arose, despite leadership being a concept of interest at the beginning of time. Basically, leadership theories aim to understand how and why certain people become leaders. It may be seen as schools of thought that have been brought forward to explain how and why such people become leaders. Some leadership theories that are well known are the contingency theory, transformational theory, participative theory, great man theory, trait theory, situational theory, and skills theory. There are two prominent theories that will be further elaborated, which are the contingency theory and transformational theory. Contingency theory implies that the organizational success benefits from the organization's fitting features to contingencies that represent the organization's condition. According to Bass and Avolio, transformational leadership ensures that leaders should specifically define a constructive blueprint that could be exchanged between companies, which can be divided into three elements: charisma, intellectual stimulus, and human concern. The purpose of this article is therefore to identify and examine leadership theories applied in COVID-19 outbreak management and identify the behaviors that leaders can adopt to improve their own leadership abilities during COVID-19. Moving on, I'll further elaborate on the contingency theory and the transformational theory. The contingency theory consists of two themes, which are the positional power and task structure, whereas for transformational theory consists of two themes, charisma and Adilah's influence and inspirational motivation. Fiedler's contingency theory explains how the relationship between leadership models and the situation to be handled can have an influence on how successful leadership is. It is a hybrid model in which the personal qualities and motivation of the leaders are said to communicate with the actual situation facing the group. Hence, the contingency paradigm marks a step away from the tendency to assign leadership success to personality on its own. Centered on contingency theory, there are two factors that can identify scenarios and influence the efficiency of individual leadership. The first factor is positional power. Positional power reflects on how the leadership style and ability impact the outcome of the situation. An example of strong leadership and decisive leadership style comes from the New Zealand, where the Prime Minister Jacinda Ardern introduced its highest level 4 lockdown measures in March. Her decision to impose a national lockdown much earlier than other countries has contributed to a lot on controlling the pandemic itself. According to Lin et al., apparent system of leadership was shown by Taiwan government as soon as China reported the unidentified outbreak to WHO on December 21, 2019. Taiwan rapid implementation of disease prevention measures helped detect and isolate the country's first COVID-19 case on January 20th. They managed to handle the situation effectively and proper delegation of tasks based on the previous experience handling SARS. The definition of leadership in general outbreak response control, according to Gould, Gallagher, and Allen, elaborates on the individual leader's capacity to inspire, show charisma, and have a positive role model. Let's now turn to the second factor, which is task structure. The task structure element tests the activities that need to be carried out as instructed by the leaders. Are they straightforward, true, or bug? Bug tasks minimize the favorableness of the situation and improve it by means of precise and direct tasks. As what was done by the New Zealand, country's strategy was based on speed testing, contract testing, and isolation, while rigorously adhering to public health guidance. This is supported by a research done by Wu et al. On previous outbreak SARS epidemic management in Taiwan, which revealed that the outbreak situation required a rapid spread of disease, rapid intervention, and advice to control all stages of alert. According to Stewart et al. And Nenswa, Engineer, and Peters, outbreak management also requires a dedicated and coordinated rapid response to local epidemics with regular and planned stakeholder engagement. It can be inferred that in order to be successful in handling a pandemic, people must work in a specific way and towards the same goal as stated in the contingency theory. What is appealing in this idea is how it offers flexibility for the future. Management, by establishing an efficient working group of specifically specified tasks, helps them to be motivated and avoid any confusion or frustration, especially in this demanding and exhausting period. The contingency principle offers hope and encourages the idea that with the right situation, almost everyone will become a successful leader to deal with the crisis at hand. In the case of outbreaks of disease, leaders must work to find a place for themselves and work with their team to guide them to effective outbreak control. For this paper, a scoping systematic review was done. Based on the research question, relevant articles were identified using databases such as Corpus, ScienceDirect, Google Scholar, and PubMed. This paper will review the articles according to the objective mentioned above. A comprehensive and retrospective examination of records, minutes, and key leadership processes used in decision-making was the basis of the case study research. Documents from the Ministry of Health, the World Health Organization (WHO) have been reviewed, and various local and international news media as part of an effort to document the timeline of interventions and the pandemic curve, which are reported in detail elsewhere. The system of crisis management activities and leadership through a focused literature review, hypotheses were found. The system of crisis leadership thus was used to evaluate if the disease fighting practices helped to combat the outbreak during the various phases. Discuss main crisis leadership tasks about the outbreak. A crisis involves a rapidly changing situation that may require changing leadership approaches. The generic tasks and behaviors related to a goal setting, decision making, and maintaining relations between members of an organization. Moving on, the first aspect that was discussed in this article is moral dilemmas. COVID-19 poses a host of legal medical dilemmas for healthcare institutions. Treatment rationing is one of the key issues facing healthcare practitioners according to health leaders. The significant rising trend of the cases puts the leaders in a tight spot on how leaders should ration resources evenly, particularly ventilators for patients in the intensive unit. The American Medical Association (AMA) had published recommendations on the Code of Medical Ethics for healthcare practitioners. The guideline offered requirements for available services through assessing the significance of medical necessity, the probability and estimated length of gain, and the difference in quality of life after treatment. Due to shortage of PPE, the physicians will have to treat the patients infected with COVID-19 without proper protection. Hence, this will raise moral dilemmas for them. The AMA guidelines stated how physicians can ethically refuse to provide treatment if PPE is not available after considering the expected level of harm. According to MacArthur, leadership plays a pivotal role in solving these medical dilemmas during the crisis. The AMA recommended that as representatives of the healthcare team, those health practitioners should lobby for funding and support them. Decisions made by the health practitioners should be based on the latest available facts, decided in advance if possible, shared freely and transparently, and subject to adjustment and evaluation as the situation progresses. Next aspect is crisis intervention strategies. Crisis intervention strategies are needed to ensure that the societies can eventually return to their norms. The strategies must be planned accordingly to ensure successful implementation. Any inappropriately timed strategies could bring the possibility of rapid upsurge in the transmission of COVID-19. For countries that have adopted stringent physical lockdown policies, a study of current techniques is needed to ensure that there is sufficient contact tracing in order to minimize the possibility of disease recurrence before crisis intervention strategies are taken. According to Townsend and Kassam, as the rigid physical lockdown can be destructive at both the social and economic levels, bringing more pressure on current national problems, there are already concerns that individuals have struggled to comply effectively with this public health guideline as a result of so-called isolation fatigue. Next, there are three exemplar leadership traits that a leader should have, which the leaders must be good in planning and coordination, openly communicate with public, and act swiftly and decisively. Firstly, planning is pivotal to every national crisis, and in particular a pandemic that affects any aspect of society, and successful coordination is also necessary. According to Piri et al., in Bangladesh, previous pandemics related to the coronavirus have presented evidence of healthcare workers becoming contaminated due to occupational contact, and show the importance of prompt sharing of reliable knowledge and constructive cooperation in producing a successful response. This is important for the transition of national guidelines to clinical personnel offering treatment, and for ensuring that they obey the most up-to-date best practice while at the same time being free to use individual clinicians' discretion. A similar framework can also be followed in individual patient care delivery environments with established lead physicians capable of organizing successful response in their field of expertise. National coordination is equally important, as a good national leadership maintains the consistency of mission and policy as well as cooperation with other countries for support and organized responses. According to Tiong, coordination often includes the integration of input from groups voicing their issues that may cause emotional pain, and the establishment of successful partnerships at the local level. Next trait is The leaders must openly communicate with public. Effective communication is the core characteristic of good leaders in the public health crisis, as even the most productive and strongest solutions can be made counterproductive by insufficient or unreliable communication at the government level or by communication that is not effectively embedded in the society. Communication, especially successful crisis and danger communication, which is important during pandemics, including the COVID-19 pandemic, should be prevalent in many developed countries to substantially reduce, among other things, the degree of panic levels and the number of infections, according to Taguba. In reality, inadequate communication will worsen the current threat. The plans used by national authorities must represent a careful, reliable, insightful, and evidence-based approach. Post-pandemic leaders should collectively recognize the efforts of all core staff, programs, and societies. Leaders will have a vital role to play in outlining the lessons gained to encourage timely action in the event of potential public health emergencies. The last trait is a leader must act swiftly and decisively. This was a leadership approach similar to most countries that have successfully resolved the epidemic of COVID-19, including New Zealand. A few days before declaring a national lockout, within a month of registering the first case of COVID-19, New Zealand has calculated that it has opted to follow an elimination approach to manage the COVID-19 epidemic rather than the normal containment strategy, according to Cousins. The ability to act effectively and decisively, even though it brings political risk, is certainly one of the most significant